Anyone else care to admit?
Yeah, I'll jump in because I had this recently. So that's the way I approach it when I'm on the other side too. And that's what I was saying. Like most of the time I don't say anything, but there are times when I step in and almost like confirmation. I understand where you're coming from, and then that way we can skip a lot of the more detailed explanations. And I think it's usually fine. Most physicians kind of appreciate that. And so I agree with that also.
But do you keep it a secret until the last minute and then like drop the bomb that by the
I,
way I'm a physician, or
I have.
do you like like hint at it? Like how do you segue that information in there? Because I'm always not sure how to do it myself. Like walk in and be like, oh, I'm a doctor, or then like hide it from not let them know and then maybe mention it towards the end.
I don't know if I hide it, but I personally, when I go in, I really do want to be a patient because I have been in situation where, yes, I'm a pediatric cardiologist, but I don't know anything about this part of it. And because they know I'm a cardiologist, they skip some things that I actually really want to know. So there are times where, especially when it comes to like surgical things, I do not necessarily hide it, but I don't say much about it. And then towards the end, I'm like, I really appreciate that. I am a physician as well, and I appreciate that, that. And a lot of times they're like, oh, no wonder you understood when I said this, and you said that makes sense now. So I don't know if I'm necessarily hiding it versus I really want to just be a physician. I mean, a patient and not a physician in that setting. Because sometimes, like you say, they jump in and like, oh, thank God you're a physician. I don't have to do any of this, but maybe I do want that. I do want that simplicity. I do want, especially if there's another family member like my kids or, I do want them to be part of the conversation. As a fetal cardiologist, I do a lot of counseling. And I actually ask my patients and their partners or family member if they are in healthcare. I actually ask mainly so I know how to speak to them and in what detail they want. And I tend to speak at I don't want to use the word lowest, but at, the non-healthcare